So hi, you guys. How are you doing this afternoon?
Yeah, absolutely fabulous. It's super excited. We're on real countdown now, aren't we? How about you, James?
Yes, very, very excited. It's 1st of July is etched in the mind and etched in the calendar. And yes, very, very much looking forward to it.
Oh, so great, isn't it? National Advanced Care Plan Day 2026.
Can you believe it's the third year? You're saying that out loud, Danny. I've got shivers going down my spine. This is our third Advanced Care Plan Day conference and awareness day. It is so exciting. Super excited to be working with you both again on this.
Yeah, me too. And I'm so pleased how successful it's been, and that's why we've been so lucky to get the sponsorship from the NNN Hospitals charity again. And also, I believe, James, you've also got some great sponsorship for the actual ACP day itself as well.
Yeah, no, it's amazing. Sue Ryder has kindly joined us and partnered with us this year. So it's meant that we can spend more time and more effort making a noise, extending the website, and getting people to document what matters most to them, and also empower others, such as their loved ones or their patients.
Yeah, perfect. What do you reckon we should go to next? Because James, you've mentioned the website. There is so much work. There is so much work done on that website. Can you just talk us through the changes on the website? If people are landing on it on the first time, what can they expect to find, and what are the updates on the website?
Definitely. So once again, we've got a range of different resources to empower the general public, but then also educate health and care professionals. So the goal is to obviously help normalize advanced care planning and to ensure that people's wishes are met, whatever it is, at whatever stage of life that they're in. If you are planning to host your own Advanced Care Plan Day event,
do it. Even if you haven't thought about it, think about it now. Do it.
Exactly. And it's very easy to do. So you don't need to try to reinvent the wheel. You might just simply decide to have a watch party. So there's the live stream from the conference again this year. You can go to the Advanced Care Plan Day website, to the conference page, Conference 2026, request the stream, and we'll send you a free stream. And lots of people, again, will be having watch parties. So you might want to do that. You might want to, if you are working in a hospice or a care home, have a stand as people walk in, or provide resources and support on the IPU about the value of advanced care planning. And we've got conversation starters, some prompts that people can fill in, and other pieces of literature and resources that people can use. So if you're thinking and you're not sure what to do, you might want to do that. If you've created your own resources, or if you have got a news story to talk about some of the advanced care planning that you've undertaken over the last year or 2 years, again, you can publish and share that information. If you use the hashtag ACP Day 2026, we will reshare and help promote it, as we will if you create an event and you decide to host your own event and you go to the website and you tell us that you're running a Advanced Care Planning Day event. We will again add it to the listing on the website, promote it, share it, etc. And then apart from that, we're sending out emails, we're raising awareness. We've had some great coverage in eHospice and the Carer magazine, for example. So yes, we are taking this kind of wider public professional approach to all things advanced care planning. And the date for the diary, once again, is the 1st of July.
Brilliant. Danny.
Can I just butt in? You know me, always listening. But you were talking a lot about hospices. I know you're talking about watch party, but this really isn't just for healthcare professionals. This is very much for the general public, isn't it? Because this is a social event. This is not a medical event at all. We're all kind of responsible for our future plans and what we want. So we are really trying to push it upstream, because I know we had lots of people who attended the conference and did the live stream, which were healthcare professionals. But we also did have quite a lot of people who were just general public who actually thought, you know what, I want to find out a bit more. Especially we had a high number of carers. Yeah. Is that right?
Absolutely, and I think it falls beautifully. We've just gone through Carers Week, and I think it really highlights the conversations that need to be had. There's some fantastic stuff in social media at the moment, and in the media, on television. There's themes. I don't know if EastEnders have deliberately done it to align with Carers Week, but there's some brilliant themes going. You're getting excited there, Danny. We're hundreds of podcasts in the making here, but there are so many themes that are it also feels like it's coalescing this year. There is so much conversation, and 100%, this is about upstreaming it. This is not a medical event. This is open to absolutely everybody to have these conversations. And James, I wanted to pick up on what you said about watch parties and join yours as well, Danny. We can go through the agenda in a minute because I'm so excited by some of the I guess that we've got coming. And if you're going through the agenda and think, I'd really like to find out more about this speaker, by all means, if you haven't got the whole day to spare, come along. We'll go through the agenda and think, well, put that in your diary, join us for that particular speaker, because we've got some absolutely brilliant speakers coming up, haven't we?
And also as well, if you think, I'm actually not going to have much time to actually see everything, still join us because it's recorded, and then you'll get the whole recording afterwards. Normally about 2 or 3 weeks later, you'll get it, but you'll get the whole recording. So even if you can only pop in if you're working, like quite a lot of I'm going to do a shout out to all my specialist palliative care nurses who still will be working. They'll be able to pop in their breaks and have a little look, but they're still registered because then they'll get the whole recording afterwards. So please, if you're not able to attend, still please join so we can make sure you get that essential recording.
Brilliant. And last year, we after we hosted it last year, we had a discussion about the themes for this year, and it was really exciting to hear people's responses. And James and Danny, even more exciting to go back. It was a bit like you said we did. So we've listened to what people said, we've listened to what people wanted, and we're sticking with advanced care planning, we're sticking with upstreaming, we're sticking with those concepts of getting your house in order, what you do want, what you don't want, who'd speak for you, legacy, and yes, a bit of end-of-life care. But focusing this year, Danny, do you want to shout out on our focus? Because it's
our focus this year is really a little bit quirky, because what we're focusing on is marginalised, so people who are marginalised, and this is often a topic that does get forgotten. So we really wanted to shine the light and actually put the whole conference on it. We did have a lot of feedback from mainly actually carers when I think back of, well, how can I do this if I had, for example, my son is disabled, or my child has got ADHD, or my work colleagues when they're talking about, but we even had one, didn't we, who was somebody from the prison, and that was one that's something that we weren't able to get this year. But again, it's just trying to support people who are marginalised. But I'm not going to mention everything now because we're going to go through the agenda and just highlight some of those key speakers, because often I think we think about marginalised and we automatically think about those kind of stereotypes. But actually, when you look through, there's so many people who are marginalised who you wouldn't think would be.
I've learned so much recently, actually, through some of the podcasts. It's been really humbling. There's a few podcasts that I've done recently, and you can hear my voice break because it's almost not embarrassment or shame, Danny and James, but it's almost that sudden awareness, thinking I hadn't thought of that. I've done this for so many years, and someone said something to me. I thought, God, I hadn't thought of that. So it's really great to continue to learn and to continue to share.
Well, it's like this year, sorry to butt in again, James, you're never going to stop us two from talking, but it's so important this year that we've never thought about it before, but it ties in lovely with the marginalised. We've actually got 2 amazing BSL interpreters. So again, for people who are deaf, like, blimey, why didn't we think about that before? It's just didn't even come into our heads. But we've actually got Here Norfolk coming is one of the stands, and it's such a high percentage of people out there who are caring for somebody or who are themselves hearing impaired. So it's essential we have this.
Yeah, really exciting. So does that lead us into going through the agenda?
Oh, it does.
God, who's going to do that? Who do you reckon?
Oh, come on then, let's go through it. So our first speakers are renowned to me. I'm super excited because she is an absolute legend, is an amazing GP down in Suffolk. Her name is Lindsay Crockett, and she is done this inspirational project. And I'm not going to say too much about it because obviously I want you to come and listen. But she is focusing on a project where she's working with volunteers to support people in the community to do and raise awareness of advanced care planning. Because often these people, like, for example, frailty, you wouldn't even think about frailty being marginalised, but it is. Because often people who are frail, who are unfortunately elderly, don't maybe have anyone to talk to, or maybe people just assume they've already done advanced care planning, or actually then haven't got access because they can't digitally look at something. But there's so many people out there, I know because I work in the hospital, how many people who are over 80, and that's not even old, over 80, I can't even mention the ones below 80, who've not even thought about what's going to happen. I have so many families who coming in and their loved one is 102 and they're like, oh, so shocked. And the actual person who's dying again is like, we never thought we'd get here, because again, they haven't got a condition. This is the thing, they haven't got a condition. It's just naturally becoming older and frailer and approaching the end of life. But back in the day, we never talked about it, did we? So Lindsay Crockett is coming to really, really kind of shine the light. She's going to be with 2 other colleagues of her, who's going to really, really focus on her volunteer projects. And I'm not going to say too much now, but there is a really special announcement going to be coming up about Norfolk and a similar project, but I'm not going to be saying anything because I know I'll get told off. But yeah, please do come and listen, because this is something, if you're a GP practice, this is something to think about. Like, the amount of time that you can save, the amount of people that you can really interact with and really support them to make these really important decisions, and actually feel that you are involving the right people at the right time. Oh, it's a no-brainer. But I'm going to let Lindsay, Bill and Kate talk about that a bit further. Sorry, I know it's not, I've not really told you much, but the title of the talk is The Missing Bridge in Advanced Care Planning: Volunteers, Empathy and Time to Have Conversations.
Lovely. I think that's a really good opener for the day, Danny. You know, you said right at the beginning, this is about opening up to all communities, and I think that's a great scene setter, setting the scene for open it up to everybody to have these important conversations. So where do we go after that? Jem, have you seen Irene talk before, James? I know you've been at lots of healthcare conferences. Because we're going
many years ago, but I believe this talk is not one that I've seen before. I've seen her do some work with Kingston University. This year's talk, How to Involve People with Learning Disabilities in End-of-Life Planning, looks wonderful. And I'm obviously very familiar of the impact that she's made over the years through her publications, her research and her campaigning. So I'm very much looking forward to this talk.
Yeah, it'll be fantastic, and she'll be sharing the Victoria Institute toolkit. Again, not going to say too much about that, but we'll be able to find out more about that brilliant piece of work. People can come along, find out how to access that and to support people with learning disabilities. So very exciting and privileged to have Irene as our next speaker on stage.
Yeah, I was like amazed, because I didn't even know that when I was reading through her bio. She is a professor of intellectual disability and palliative care.
Yeah, she's brilliant.
I was like, never even thought that existed. I know that sounds bizarre coming from me, but I was like, wow, that is, God, such an honour to hear her speak.
It is, and I don't think we have on stage this time, but often she's presenting with people with learning disabilities that she works alongside. You know, very much fantastic co-creation as well. had the honour of interviewing them for one of the podcasts, and the work that they've created and made available for all of us will be really exciting to hear and learn a little bit more about. So another fantastic speaker. And then leading us to, who we're going to pick on next, Danny?
I think
where to go next?
A very famous speaker
Very famous,
joining us, and that will be James Norris. And the title of his talk is Supporting People and Communities Who Are Digitally Marginalised. Tell us more, James.
Yeah, so as we increasingly move from the physical world to the digital world, whether it's members of the general public, patients being supported, or healthcare professionals, people are becoming increasingly marginalised due to the emergence of technologies. It could be because of their location. It could be due to financial reasons, not being able to pay for the internet. It could be with the emergence of artificial intelligence and people being ahead of the curve and being able to access these resources. There's so many ways in which people are now becoming marginalized because of the internet, and the internet and technologies should be an enabler. It should help improve things. But this talk will look at some of the ways in which these inequities are kind of being addressed, some of the ways in which we need to do better, and some of the ways in which, you know, looking ahead to the future, things are likely to change. So yeah, it's going to be hopefully an interesting talk. It's something that's becoming more and more important, especially with a lot of NHS services being kind of digital first. All of these things that are kind of coming all at once. We've got an AI revolution. We've got a kind of a push towards this digital first world or country or nations. But yeah, there's lots of ways in which, you know, different communities for a number of different reasons are being digitally marginalized, and that's what I'm going to be exploring.
I'm really looking forward to that, James, and I know we've all got family independence as well, so I think I'll be watching or listening to you with a really personal hat on, because I've had so many conversations, taking it quite apart from professional conversations. You know, all of us are people within our families as well as professionals, and I know the impact and the challenges that digitalization is created amongst so many people that I know and love. And yeah, it can be fantastic, but it can create so many headaches. I was interested to hear you talk about the financial limitations as well, and of course it isn't just being able to use it, but it's physical, financial. Yeah, really looking forward to that. And I think in the push towards doing everything online, we are leaving people behind. So who are we leaving behind, and what can we do about it? How do we raise awareness? Thank you.
And Norfolk itself has the highest population of elderly in the whole of the UK. And I'm not saying that if you're elderly, you're digitally marginalised. Definitely not, because I know some very experienced and knowledgeable elderly people. However, like in Norfolk, unfortunately, when I meet in the hospital, there's quite a few people who have not got access to it, like you said, haven't got access to the internet, or actually find it really difficult to navigate. So yeah, I'll be extremely interested how we can support our patients going forward. So yeah, I'm really looking forward to that as well.
We've got so much on this year, haven't we? Every year we do it, we say it just seems to be growing and growing. So after James, we're moving on to No Barriers Here. You know, we've got brilliant content throughout. So, Danny, do you want to talk about No Barriers?
Yeah, I'm really interested in this. The title of the talk is Equity Orientated Advanced Care Planning, Reflections from the No Barriers Here project 5 years on. So I'm really interested in this because quite a few of my nurses actually did the No Barriers Here training and found it so useful. And we actually use it within some of our clinics as well. So I'd be really interested to hear that. And also I'm really interested to hear Dr. Jed Jerwood speak, because again, fascinating. His background is obviously as a psychotherapist, and a lot of his background actually has been in mental health. So I think I'm just gonna find it so fascinating on him talking about No Barriers Here, because I know it was primarily started focusing on people with learning disabilities. But I do know that the No Barriers here has also really started to expand and work with other marginalised communities as well, and people with other different, unfortunately, such as mental health. So yeah, I'm going to be really, really interested in hearing what they've done, and not only what they've done, but what challenges they faced. So yeah, another really exciting one.
From a personal perspective, so I've never seen Jed or Gemma from No Barriers Here speak before. Did go on a No Barriers Here workshop at Public Health Palliative Care International 2 years ago, and we all got so we sat around. I think there was maybe about 12 of us on the table, and we had to conceptualize and envisage our deathbed, and it was hands-on straight away. It's almost like kind of like art mentality. You're thinking, you're cutting, you just go at it, and everybody around the table is doing the same, and you're engrossed in your own world. And for me, the most fascinating thing was, if you wish to do so, you could share what you'd created and what you'd envisaged. And I mean, I've tweeted it, I've shared it at the time, and people were doing very abstract work, people were doing all these different things. And I looked at mine, and mine was almost, and I said at the time, it was like a Disney deathbed goodbye. And it was so simplistic. And I love art, like I love modern art, I love all these different things, but to get into my brain, and when people were kind of explaining theirs and the concepts behind it, and then mine's like, hi guys, like, I don't need to explain it, it's so simple. But it was amazing. It was that kind of moment of reflection, seeing what people had envisaged and how different it all. It was incredible, and it's one of the best like workshops or thought processes that I've kind of gone through in terms of advanced care planning and end of life planning. So I'm really, really looking forward to learning more in a theatre rather than the hands-on this time.
Yeah.
You could bring it along, Jack. If you still got it somewhere, you could bring it along.
Say that. If you Care Plan Day website, on the homepage, there is a No Barriers. There's a piece of artwork, and that is the artwork. The picture of my artwork in PHP. It's the So that's the one. It's kind of the hands, very, very simplistic, but again, fascinating to be able to delve into my mind, but more interesting, delving into other people's minds and reflecting and contextualizing your own thought against other people's. Like, brilliant, really, really good, and cannot wait to see and learn more.
I think it's fun for all of us, because although we're co-founders of the day and we're organising, and we know, I love the fact that each one of us, you can see all of our faces. We're sort of jumping and getting excited, and it's just so exciting to be part of. And yeah, it's a privilege to do this, isn't it? It's a privilege to be part of it. It's a privilege to talk to these brilliant people. And Danny, you do so well to, Norfolk and Irish, to get that funding behind to enable this. James, your skill on the website. We are so lucky. We are so lucky.
I agree. So lucky. And that leads us on to our next talk by Dr. Emma Clare. This is a talk I am very interested in, because her title of her talk is Advanced Planning and Neurodivergence Towards Accessible Approaches. So I think she's really going to analyse and explore what are the current approaches, what works, what doesn't work. And this is something that's really coming to the forefront at the moment, isn't it? It's, what does neurodivergent mean as well? Often people are like, well, what does that encompass? Is that people with ADHD? Is that people who are on the spectrum, who've got autism? What actually does that mean? And actually, how can we support these people who actually their brains work differently? And I think this is going to be such a fascinating reflection from Emma, because, and she's written this herself, she herself has also got personal lived experience with it.
It will be. I've interviewed Emma. I need to do a swear pot, don't I? Each time I say I interviewed someone for a podcast. But Emma's been a guest and talking about her neurodivergence and why she set up the Death Wired Differently website as well. That was one of the things. You remember I said I went goosebumpy and thought I should have known that. I should have known that. And the things that she was talking about, absolutely fascinating. I think I'm not going to share too much now, because it's the stage will be Emma's. But I know, you know, I've been doing this job for 30 years, and a 30-minute conversation with Emma taught me so much. So really looking forward to hearing her take the stage and share something that we will need to learn a little bit more about as well. Sometimes about ourselves, about other people, sometimes hidden, sometimes not so hidden. But yeah, really be interesting. And to close, we've got closing reflections. Aren't we excited? Who is contributing? Who's going to talk about our final contributor for the day?
The speaker that needs no introduction.
We were just sat here silently saying we can't. What can we say? Go on then, James.
So Catherine has obviously been a pioneer in many aspects around advanced care planning, tender conversations, and she's very kindly going to join us virtually. I'm not sure if she's still going to be in Australia at the time or not, but on a tour. But she's going to be closing with a video contribution, bringing it all together, and ending the conference on something very special. So yeah, we're honoured and delighted to have Catherine joining us at this year's conference.
Absolutely. And I think, you know, for people walking out of that stage, Danny and James, walking out of the conference, to have the final closing words from Catherine, I know people will go away, you know, absolutely elated and with some great key messages and steps forward, and hopefully some great inspiration.
Absolutely. And that's not it, because we just talked about the speakers. There's
I've written down. Come on.
There's so much more. Like the stands this year, it's exploded. Like in the breaks, we always have our stands. So if you're attending in person, you get this added bonus of actually meeting people who are currently working or having services or some way engaged within advanced care planning. And this year we have over 33 stands there. So it's going to be fascinating. We've got 2 breaks where you can really engage. But if you are live streaming, don't worry, you won't be left out, because in those breaks, the people who are having the stands are putting together some videos, some posters on their services. So that will be shared at the break time. So you can still get the benefit of finding out of those really innovative, essential services that are out there. I'm also going to touch on something very exciting this year that we haven't done before, and it's Off the Twig. Do you want to say more?
So we are lucky to be joined by Sue from the Off the Twig theatre production, and she will be doing an immersive experience. So we've taken over. We're lucky enough to have enough space, Danny, aren't we? We've got one of the upstairs rooms, I think, isn't it? So one of the upstairs rooms.
Downstairs. It's going to be on the downstairs room. I changed it to downstairs. So again, thinking about marginalised, it's even though we do have a lift, but that makes it even more accessible.
Perfect. So it will be an immersive experience. People can go in, people can go out. There'll be surroundings. People will be able to really take part and to reflect, and to bring theatre to the conference as well is absolutely amazing. So yes, people will be able to take part in that. With the breaks are really decent and long, aren't they, to give time for the stands, for the theatre to experience all of these the immersive experiences as well. So yeah, it should be absolutely fantastic.
Yeah, really looking forward to that. And oh god, and we have the book launch, the absolute book launch of the best-selling author, one of the best-selling authors, Evie King. She's going to be there in person signing her new book. Last year, we had her as a key speaker, and she was talking about the first book that she wrote, which was called Ashes to Admin. So if you haven't read it, please look it up. It's awesome. But what she's going to be doing is launching her book, and there's going to be copies available for you to buy and have it actually signed for you. Brilliant. How exciting is that?
I think it's a fantastic, if you're a part of a team, if you're looking, I think it's a really quirky Christmas present, Daniel.
Yeah.
Super quirky Christmas present. For the person that's got everything, Get Ahead of Being Dead.
Absolutely. What was that title again?
Get Ahead of Being Dead.
Yes, say it out there. And James, are you bringing some of your books?
Yes, yep. So there will be some, and if anybody would like my signature, you're welcome to have it. But the book is really good. It's called Technologies in Palliative Care for Older People, and it's written by me and 3 other wonderful authors. And it's exploring how technology is being utilised in different ways. And it's published by Springer earlier this year. So that will be available. I'll have copies for sale at a very, very discounted rate.
Wow.
So discounted. I bought it at a discounted rate, and I'm going to be selling them for even less. So I lose money on each book that I sell just to get it out there. So yes, there will be copies available, and I guarantee it'll be the cheapest that you'll be able to find it.
Perfect. Do you know, talking through, I can't get
so Claire, I'm going to interrupt. So that means we've got 2 best-selling authors.
We have, and we've had this conversation. We thought we'll have a quick catch up about the Advanced Care Plan Day conference and the day. And we're doing all of this in a day. I cannot believe we've got so much content, theatre, presentations, live stream, networking, live book signings as well, all in one day. So shall we run through?
You forgot lunch.
And lunch, what else?
Free lunch. There's a free lunch. This is all free. Like, can you believe it? I can't believe it, to be honest. But it's free. And you get to eat.
And you get to eat. James, were you going to say something before I go through everything? So all our bases.
Just a caveat about it all being on one day. So all of the conference stuff and the Advanced Care Plan Day, yes, 1st of July. However, there's a number of events leading up and afterwards across the UK. So if you go to the Advanced Care Plan Day website and go to the events section, you've got certain hospices and charitable organisations putting on events on different days. Whether or not it's because they're all going to be tuning into the live conference on the 1st of July, I don't know. But there's different talks. That some of the events are online, some of them are face-to-face. If you are hosting your own event, once again, make sure you let us know, and we will publish and promote it on the website as well. But there are events going and taking place throughout the week, either side of the 1st of July. So yes. So just when you thought they couldn't be, go on, Jenny.
Because I know there are events happening and they're not on your website.
Oh.
So those naughty people out there, you better get emailing to James or going onto the website and announcing it, because I know there's events out there and you need to share them.
Danny be chasing you. So can I go through? You know, I'm sorry, go on.
I was just going to say, Danny, can we have an update on the number of people who have reserved the tickets so far? Actually, I could probably, if not. So
I think when I was thinking the other day, we have got in person, haven't we? Over 200 people already attending. It's only been live a few days.
221 in person.
Wow.
So you better be quick. So come on, guys, grab your ticket.
Yeah, and the capacity is obviously sold out for the last 2 years. The capacity is 320, and we've now exceeded 220.
That's a push. Brilliant. Normally it's 300, so don't be sharing it's 320.
And 216 wonderful organizations and people have reserved the live stream already as well. So yes, it's
brilliant.
Since we announced it 15 days ago, we're more or less halfway until from announcement to the actual day of the conference and ACP day. So yes, the numbers are looking great. Again, expect it to sell out, although tickets are free, but it will still sell out. And then the live stream, it's going from strength to strength. So yeah, register, put the date in your diary, and enjoy.
Brilliant.
And I'm going to add, this is not just for the UK. This is international.
I was going to say, Danny, do we know how many international or how many other countries are joining yet, Danny?
Not at the moment. I haven't looked into that, but last year we had quite a few. I think we had over 16 different countries live streaming. So please, other countries out there, where whoever you are, live stream, because this is an international topic. Advanced care planning is international. As we said last year, it might not be called advanced care planning wherever you are, but it is still planning for the future.
Yeah, it doesn't matter what you call it. It is about planning ahead. We're not precious about the names, precious about the terminology. We know it's called different things in different countries. It's called different things. We all work and live in different areas. We've all got different names, but it's about those basic concepts behind what matters most and putting plans in place. So is it worth just going through the really important key messages that people need to be going away with? So, Danny, I'm going to go to you with the first question. Really short and sharp. This is like, what do they call it on a quiz station when you do those final shout out questions?
It's like
quick fire round.
quick fire.
round. Right, Danny, when is the conference?
1st of July. It's at the John Innes Centre in Norwich. Registration starts from 8:30. Come and get your coffee. And the actual live streaming or in-person event itself will start at 9:15.
Perfect. James, how can people get involved?
They can get involved in a number of ways. They can host their own events. They can speak. They could just have a conversation about what their wishes are with their loved ones. You know, it's advanced care planning. It's us as individuals. It's what matters most to us. If we do support people as carers or as care professionals of some description, then what can we do? How can we make a difference in our place of work? Can we have an event? Can we print some leaflets? There's a whole resources section, Advanced Care Plan Day 2026 resource pack. You can download them. Everything's open and free to use. We've got pledge cards, which you can print out and have in your hospice or your care home. We've got sharing cards that you can share on social media. Ultimately, go to the website, www.advancedcareplanday.org. Go and have a look through the website and think what's best for you, the communities that you serve, and your loved ones.
Fantastic.
So I'm just going to add on that. So really what you're saying, James, all the work is done for them. Is that right?
Well, the
pretty much.
Yes.
Pretty
Yeah,
much
let's
all
say-
the resources are done.
I'll let
They
you-
are. So therefore,
there's-
don't. It's all done. So therefore, every GP surgery out there, every hospital, every care home should print these all out and display them. It's your mission.
Definitely.
Get doing it.
Pharmacists, libraries.
Libraries. Amazing.
Libraries,
Shout out to
pharmacies.
libraries. Come on, libraries.
Any waiting room you are in, pharmacies, any group
And-
you're part of.
And webmasters, comms people at different at the NHS, at hospices, care homes, etc. Write a blog post, share what you're doing, share information, tell people what advanced care planning is, tell them why it's important. And if you've got your own resources, share them and promote them. And again, we will help promote them because this is like a community effort. It's you know, we're trying to work in collaboration with everyone. Everybody wants the same goals, that everybody documents their wishes and that they have their end of life wishes adhered to. Very, very important. Everybody's aligned. So, you know, the more noise we can make collectively in our places of work, in our homes, with our loved ones, with patients, etc., the better.
Yeah.
Perfect.
And I think as well, newspapers. News. If you work for a newspaper, if you work for ITV News, BBC News, it's your responsibility. You should be sharing. This is National Advanced Care Plan Day. It only happens once a year. Why aren't you sharing it? Tell us.
Perfect. I am so looking forward to seeing you both in person. I don't know, always seems a real treat to meet you both.
Yeah,
So
likewise.
how-
And it's
Cannot
kind
wait
of like
for it.
Chris.
Yeah, one day a year we get to give each other hugs and smiles and passionately talk about advanced care planning, the benefits of it, because there's only but benefits.
And remember, advanced care planning is life, not just for the day.
Exactly. Like a puppy, not just for Christmas.
Perfect. Have we covered all bases, you guys, do you think?
I think so. Yes. It's been a wonderful chat, and I think we've got most of those messages out there. But yeah, obviously to learn more, visit the website. There's so many resources on there. And if you need any help or support, get in contact with us through the support page, and we can help you with whatever questions or whatever information you need.
And if you are listening now and you do you think, oh, actually, I had no idea I could have had a stand there, I still have a couple of stands left. So if you want to stand, give us a shout.
Great. And if you look at the website details, you get a flavour of the past events as well. So you can access the previous events, see the speakers, and see the quality of the day. So it's a really good place to head to, isn't it? Everything is on that website.